Now moving on to the most important disorder of cardiovascular system, that is myocardial infarction. Okay, so all might have heard about this term myocardial infarction. So before starting with this myocardial infarction, there is one more name that is related to it, that is heart attack. Okay, so in layman's language we also call it as heart attack, and sometimes it is also referred as acute myocardial infarction. Okay, now the main difference between this angina as well as this myocardial infarction is that commonly in angina the pain is less severe, and usually the duration is for less than 5 minutes, or it is less than 10 minutes actually. Okay, but in the case of mi, the duration is longer, the severity is also very severe for the person. Okay, the pain is quite severe in myocardial infarction. And one more thing is, myocardial infarction is occurring because of sustained myocardial ischemia. Sustained myocardial ischemia means continuous decreased blood flow and oxygen to the heart will result in necrosis. Okay, so necrosis means death of the tissue. So always remember, when you are defining myocardial infarction, you should have the first term as sustained myocardial ischemia. Okay, that is for a prolonged period of time there is ischemia. One term. Okay, next term is because of this sustained ischemia, the person will be having decreased oxygenation, decreased blood flow to the tissue, isn't it? Along with that, here what happens to the myocardial tissue is there is necrosis. Okay, so necrosis can happen in any part of the myocardium. Okay, it can happen in any of the segment. So that word necrosis is also important. Okay, so that these two terms are a must when you are defining about mi or heart attack. Okay, so already you might have drawn the anatomy of the heart, and also you have studied regarding the physiology in the first year, isn't it? Okay, so we will move on to the introduction of myocardial infarction. So as I have told, mi is also referred as heart attack. Why it happens? It is mainly because of the decreased blood flow, that is, it is because of ischemia. Okay, what happens when there is ischemia, or what happens when there is decreased blood flow and oxygenation? There will be damage to any part or any segment of the heart muscle. Okay, so that is regarding the introduction, and I have put down two definitions. You can go through any of the definitions, but any definition you are writing, you have to include two terms. One thing is sustained or permanent myocardial ischemia, and second one is necrosis. Okay, these two terms are a must. So myocardial infarction is a process in which the myocardial tissue is permanently destroyed. Okay, permanently destroyed. That is why the term necrosis is used. Okay, so in MI there is permanent destruction of the myocardial tissue in any part. Okay, in any part, when there is destruction of the myocardial tissue, what will happen? There will be decreased blood circulation. That is mainly because of decreased blood flow and oxygenation. So finally, because of this ischemia, what happens? It will result in death of the tissue. That is nothing but necrosis. Now one more definition is there. This is also a very easy one. So MI or acute MI or heart attack is mainly because of sustained ischemia. Sustained ischemia means ischemia which is present for a longer time. Okay, and in this MI, what happens is there is irreversible myocardial cell death. Okay, this is also one more important term there. Irreversible myocardial death happens. Okay, that is why there is necrosis here. Okay, it's not reversible, but it is irreversible myocardial cell death, which further results in necrosis or death of the myocardial tissue. So any of the segment or any of the coronary artery which branch there is complete obstruction and interruption to the blood flow, that part of the myocardium can become necrosed. Okay, next is moving on to incidence. Now you might have heard about this myocardial infarction or heart attack a lot more times, isn't it? It is a very common cardiovascular condition, and most of the time this mi is occurring because of the thrombus, that is a clot. Okay, already we have discussed how the clot happens, how the clot is occurring. mainly because of atherosclerosis or mainly because of this atheroma or plaque that is deposited in the blood vessel. So what happens when the atheroma or plaque gets deposited? More and more platelets are accumulating to that clot, and finally what will happen? The clot can become dislodged, okay, and it can be ruptured. So what will happen when there is rupture of this blood clot? It can dislodge anywhere in the bifurcated artery, okay, anywhere in the bifurcation it can be dislodged. It can go to the heart. That time it will result in MI, okay, that you should remember. It can also get dislodged in your extremities. It can also get dislodged in your kidneys. It can also get dislodged in your brain and can result in cerebrovascular accident or stroke, okay. And in India, it is seen that from 1000 people, around 65 people get myocardial infarction, okay. And it is also seen that myocardial infarction is more common in elderly population. When they have compared males and females, in males it is of more incidence, okay, and women who are in their reproductive life, that is before menopause, till then what happens is they are at lower risk, okay. Women till the reproductive period they are at lower risk because of the circulating estrogen. But after the menopause, what happens? After the menopause, both men and women will be at equal risk of getting heart attack. And it was also seen that the rate of heart attack has increased from 2% to 7% in the rural population, and in the urban population it has increased from 4% to 13%. Now, the location of infarction, where exactly this necrosis has occurred, it can occur anywhere. We know the heart is supplied by the coronary artery, that is the right as well as the left coronary artery is there, then the branches are there, isn't it? You might have studied about the branches, the circumflex artery, isn't it? So anywhere there can be obstruction, okay. And MIs can occur either in anterior part, posterior part, inferior or lateral part also it can occur, okay. So next is now moving on to the etiology. I think mostly I have told about the etiology just when I was discussing the definition. So always don't forget to write that the main cause of myocardial infarction is plaque, atheroma or the fatty deposits. What do we call when the fat or the atheroma deposits in the blood vessel? It is called as coronary artery disease or atherosclerosis. So remember, atherosclerosis is the first main cause of MI. Okay, that is deposition of atheroma or plaque. Next main causes, it can be because of occlusion. Here also in the picture you can see that is actually the plaque formation. So what happens? I already told it can partially occlude or completely occlude. How it will occlude already I told. What happens is the thrombus, okay, that can be ruptured. Okay, so plaque or atheroma which is there, more and more platelets will deposit, and afterwards sometimes there can be chances of rupture of that plaque. Okay, that time we call it as a blood clot or thrombus. So when that thrombus or blood clot is moving in the blood, it will be dislodged anywhere in the artery. Okay, so that also results in heart attack. Next one is emboli. The difference between thrombus and emboli is thrombus is a blood clot, while emboli is, we call it when it is a moving clot. Most of the time this emboli get dislodged in the pulmonary vein or pulmonary arteries. Next main cause is rupture. This point also I already told, isn't it? Next main cause is vasospasm of the coronary artery. Vasospasm means sudden narrowing. Now, sudden narrowing of the coronary artery can be because of various reasons. That is the risk factors which I will be discussing in the coming slides. And sometimes it can be also because of some acute blood loss, okay? Or sometimes bleeding disorders like your sickle cell disease and all, okay. Now next, moving on to the risk factors. Now from when I have started this cardiovascular disorders, I am continuously telling about the risk factors. By now I am sure that all of you are knowing, isn't it? Modifiable and non-modifiable risk factors. So what is modifiable risk factors? The one that is occurring because of the lifestyle. It can be modified, it can be changed, okay. While non-modifiable risk factors is you cannot control them, okay. So that is non-modifiable risk factors. So we will move on to both this modifiable and non-modifiable risk factors. So non-modifiable are aging, gender, family history, genetics. Okay. And then what happens is, I'll just tell you one sentence about each one of it. As age advances, the risk of getting heart attack increases. And about gender, I already discussed. So usually men are at higher risk, and women till the reproductive age, they usually don't get MI. But after menopause, even men and women both will be at equal risk. One who are having family history of heart attack or MI, your parents are suffered, or genetics, then in that case you are at high risk. Okay, so that is non-modifiable risk factors. Next, modifiable risk factors is also I have explained in the previous classes. In hypertension, CAD I have explained, angina also I have explained. So first main cause is excess of cholesterol or lipids in your blood. Okay, why it is increasing? Because you are consuming maybe lot of saturated fats, animal fats or trans fat, or consuming more of red meat. Okay, all those things. Next is, if you are having a history of hypertension and diabetes, the risk of getting MI is increased to 4 or 5 times more. Okay, because you are knowing in hypertension there is increased vasoconstriction, isn't it? And diabetes mellitus, because of hyperglycemia, the person will be at increased risk of getting all the complications. Next is obesity, that is accumulation of fat around the abdomen or waist. Next is sedentary lifestyle or lack of physical activity, isn't it? That is a major risk factor nowadays in the present generation. We have seen that this MI is also very common in people who are 25 years, 30 years, 35 years. Okay. Next one is a person who is having autoimmune diseases also, okay, that we will discuss in complications like Dressler syndrome. So sometimes because of certain autoimmune conditions also you can get. Next is cigarette smoking and tobacco. Why? Because it is having nicotine and lot of other chemicals. Okay, so a person taking tobacco and its products and also cigarette, okay, for about 15 years, 20 years and all, they are at more risk. People who are taking some stimulants like your cocaine or even coffee, increased consumption of coffee I'm telling about, that also. Okay, next one is alcohol abuse, excessive drinking of alcohol. Next factor is oral contraceptives. This factor we already discussed long back. Oral contraceptives are known to increase the weight also, and they are known to increase your blood pressure. Okay. Next is type A personality. I have discussed about type A as well as type B personality, isn't it? People who are having type A personality are more competitive, more stressful, isn't it? So what happens? They are at more risk of developing MI. Next is excess of stress, tension or anxiety, or people who are suffering with continuous infections or inflammatory disorders and all, they also tend to be at increased risk. Next is increased homocysteine. I told those who consume lot of animal fat, okay, they will have more of homocysteine in the blood. They are at more risk of MI. Now, there are few triggering factors or precipitating factors. What do you mean by precipitating factors or triggering factors? Means when you are exposed to these factors, you may suddenly get a heart attack. Okay. First of all, stress. Now, most of the time in the films and all it is shown, isn't it? A stressful event or something is being revealed to the person. Suddenly he is getting heart attack. Okay. So most of the time, not only a stressful or upsetting event, sometimes anger or anxiety. Okay. During that moments also you can suddenly get a heart attack because it will increase the workload on the heart once. Okay. So because of that, what happens? Suddenly there can be heart attack. Okay, and usually it is seen not in normal people but who are already at risk. Only such people will develop MI. Okay, not a common man, everyone after telling a stressful life event all will get heart attack. It's not like that. Okay, next one is cocaine use. Those who are taking cocaine or any other drug abuse is there, such patients can also get MI. Okay, next one is thyrotoxicosis, where there is excess circulation of the thyroid hormones. Okay, so here what happens is the metabolic need will be more. Okay, so because of that, more workload on the heart, so it can trigger MI. Next is exposure to extreme temperature, like very cold or very hot temperature. This already I have told, isn't it? That is why, especially when you're taking showers or bath, we see that lot of people have got heart attack and died. Okay, you should not take bath in too cold or too hot water, and it should not be like it is extreme cold temperature and again you are taking bath in very hot water or very cold water. Okay, so that time also it can trigger MI. Next one is straining at stool. Again, it is seen that people who have got lot of constipation and already are at risk of MI, when they are straining at stool because of the vagal stimulation, what happens is it can precipitate MI. Next one is heavy large meal. This we have almost discussed in most of the cardiovascular conditions. So what happens here? Because of the large or heavy meal, that also can trigger the MI. Okay. Next is moving on to sudden change in the positions. That also can trigger MI. Then certain conditions where the demand of oxygen is more, like when you are having hypoglycemia, suddenly you can get MI, or when you have got very high fever. Okay, that also can trigger MI because your what happens is the myocardial oxygen demand will be more but supply will be less. Okay, so those are the main precipitating factors or triggering factors. Even when you are having certain kidney problems, that also can trigger MI. Now moving on to the pathophysiology. Okay, it's quite easy. It is just a mixture of angina also. Okay, so this is all etiological factors. So main etiological factors is what? Atherosclerosis or atheroma formation, then vasospasm of the coronary artery, or sometimes atherosclerosis which is having plaque and which is having a ruptured thrombus. Okay, so in either all of these cases, what will happen? There is obstruction or occlusion. Okay, so what happens when there is obstruction or occlusion? Either it is partial or complete, whatever it is. What will happen? It will cause ischemia. Okay, that is what? Decreased blood flow and decreased oxygenation, okay, to the myocardium. That will cause hypoxia. You know what is hypoxia, isn't it? Decreased oxygenation will be there. So already we have seen in angina that whenever there is decreased oxygenation, the normal aerobic metabolism is converted to anaerobic metabolism, and that is why you suffer with the chest pain or anginal pain. Okay, next what happens is the thrombus which was already there, it can rupture. Okay, so when there is rupture of the thrombus, it may result in unstable angina. So unstable angina is more life threatening, isn't it? Already I have discussed regarding that. Okay, so next what happens is the thrombus can be like circulating in the blood. Okay, and then this permanent thrombus, it can dislodge anywhere in the artery, okay, or in the branches. So that will cause necrosis and death of the myocardium. Any segment can be necrosed. So that will trigger and that will result in myocardial infarction. Next is moving on to clinical manifestations. Okay, so same clinical manifestations already which I have discussed in angina, same clinical manifestations are there here also. First of all, main thing is your chest pain. Okay, so the person will experience severe chest pain, tightness like sensation, or a person will be just screaming, okay, like pushing sensation. Okay, such sensation will be there for the person with MI. Okay, always remember the chest pain here is sudden, it is very severe, and it is not relieved after rest or even after taking nitroglycerin. It will not be relieved completely. Okay, remember that. Okay, so that is the main difference between your angina and your myocardial infarction. Okay, so remember your the chest pain is very severe and usually it is not relieved by taking rest, and it will not be relieved even after taking nitroglycerin. Okay, so next one is regarding the duration. Regarding the duration, already I have mentioned, like angina pain, it is for less than 5 or 10 minutes, but here in MI the pain duration is for longer time. Okay, more than 15 minutes, sometimes it can last for even half an hour. Okay, now the pain can radiate in the same way as I have already discussed. It can radiate to the neck, to the jaw, to the shoulders, okay, and even to the upper left arm and downward into the fourth and the fifth finger. Sometimes even to the right side that it can radiate, okay, not only to the left, but sometimes even to the right side, and it can also be present in the epigastric region. So that is why what happens is some people will just tell that they are having what is that, heartburn like sensation, like gastric sensation, especially women commonly tell gastric sensation is there, or it is like heartburn. Actually it may not be, okay, it could be even mild heart attack, okay. So immediately when they are experiencing chest pain, it is well and good to go and get a ECG, okay. And what is the type of pain? Already I told, it is like a pressure, like a heaviness, burning, or tightness, okay. You cannot explain this type of pain. They will be just holding the chest and they will be just screaming, okay. So this is actually what MI and anginal pain difference. Already I have explained it. You can just go through the slide later. Next, some other symptoms are also there that is related to the chest. Okay. So why there are cardiac signs and symptoms? Because of decreased oxygenation or decreased blood flow or ischemia. Okay. So patient will experience chest discomfort, and because of ischemia, what happens to the cardiac output? It becomes low. Even if the heart is trying hard to pump the blood, maybe at some point it will increase cardiac output, but slowly the cardiac output will be going down, okay. And again, patient will be sweating a lot, okay, that is called diaphoresis. They will feel extreme fatigue or weakness. There will be change in the ECG, okay. ECG changes will be there, change in the rhythm will be there, that is arrhythmias. And patients can have sometimes hypertension, sometimes hypotension also, and palpitations. They can feel their heartbeat, okay. So ECG changes are like most of the time changes in the QRS complex, change in the Q wave, then T waves, and ST segment elevation or depression, okay. Depends on the site or the location of the this one infarction, okay. So based on that, there will be changes in the ECG. Next, a few other things that is accompanying with the MI is nausea and vomiting. Nausea and vomiting is very, very common, okay. And along with that, patient will also have fever. People tend to get fever also. It is mainly because of the inflammatory response, because of the necrosed area there will be inflammation, isn't it? So that results in fever. Next is abnormal heart sounds will be heard. Okay, so abnormal heart sounds already we have studied. Which are the normal heart sounds? S1, S2. Abnormal heart sounds like there are a lot of heart sounds like S3, S4 is there, pericardial friction rub is there, isn't it? So S3 and S4 is normally heard, and sometimes even murmurs can be heard. Now, what happens is not only the heart is having decreased oxygenation, even the lungs will receive less amount of blood flow and oxygen. So, because of that, some symptoms are seen like dyspnea, shortness of breath, pallor, heaviness in the chest, and weakness. Next is even the brain will receive less oxygenation, isn't it? All the vital organs are receiving less oxygen. So the patient may appear confused, like dizziness or giddiness may be there, and they will be really very anxious, okay, like as if they are ending the life, okay, near death experience, okay. Next is skin. So since even the skin receives less amount of blood flow, the skin will be very cold to touch, cold and clammy. Excessive sweating will be there and pallor may be there. And even the kidneys may receive less blood flow. Because of that, sometimes patient can go into shock or renal failure, and even urine output can be less. So just you can go through this mnemonics. Okay, this is the mnemonics to remember your clinical manifestations. Okay, I usually give the mnemonics so that you can remember these things better. Okay, so the mnemonics here is pass it on. Okay, so just go through that, you can write it down and you can remember the symptoms better. So next is moving on to the zones of damage or degree of damage. Okay, so before moving on to the zone of damage, I will not go through each slide, I will just explain everything in this slide. Explanation is there in the coming slides. Okay. Okay, so this picture is quite clear. We'll start from zone third only. Okay, so the zone third, that is the outer zone. Okay, you can see here, this is the outermost zone. Okay, so what happens is that zone is called as zone of ischemia. Okay, so whenever there is damage to this zone, it is not endangered. Okay, remember, it's not endangered, and it is a viable means you are able to live. Okay, if there is no further infarction, it is viable. Okay, and we can tell that it is reversible also. Damage to this area is reversible, it's all right. Okay, so remember, the zone of ischemia is the outermost zone, so damage to this area is not dangerous, it is reversible, you can reverse it. Okay, and you can live also. Okay, it is able to live. This damage to this tissue, it is able to live or sustain. Second one is zone 2, which is a middle zone. It is a zone that is in between the zone of ischemia and zone of necrosis. Okay, the second zone is the middle zone, which is between ischemia and necrosis. Okay, you can see a second one, middle one. Okay, so injury to this part, injury to the second zone, usually will not have much problem. Okay, unless and until there is necrosis. That much you have to remember. Okay, so this is the second zone or the middle zone. Next is moving on to the most important zone, that is zone of necrosis or infarction. Okay, it is also called zone of necrosis or infarction. So whenever there is damage to this area, because it is a we can tell that it is a center area. Okay, it is cut. So this is actually not outer area, this is a center part. Remember that. Okay, so this is the centermost part, and when there is damage to this area, there is irreversible damage, means it cannot be reversed. And damage to this area means that particular part will not be able to live. Okay, it is not viable, that you should remember, means it will not live. And damage to this part, that is a zone of this necrosis, damage to that part will result in decreased oxygenation and scarring also. Okay, so always remember, it will result in irreversible damage. Okay, explanation is already there here. Next is how to diagnose an MI. First of all, history collection. Now, when a person has come to the emergency ward with MI, you cannot sit and collect the history. Okay, maybe with the patient party you can do, but not with the person. Okay, so history has to be collected regarding any intake of drugs, family history, BMI, then what type of diet they are taking, whether they are performing physical exercise, all that you have to collect. And the thorough head to foot physical examination has to be done. You can also auscultate and find out if there are any abnormal heart sounds. Next most important thing that is done is ECG. So in the ECG, you will see that the ST segment will be elevated. Sometimes it can be depressed. There can be changes in QRS complex, Q wave and T wave. Okay, you need not study regarding the reading of ECG here, but remember what changes are happening there. Okay, so these are the main changes that happen in the ECG. So remember, why this ECG changes happens is it depends on the location or the site where exactly the infarction is, whether it is in the anterior, posterior, which part it is. Depending on that, changes will be there in the ECG. Next is echocardiogram, that is the ultrasound of the heart. That is what? It is a procedure in which you are recording the mechanical activity of the heart, while ECG is recording the electrical activity of the heart. This already all procedures I have explained in detail. Please go through it. Next is chest X-ray. Okay. Next one is stress test. That also we have already discussed. Next is CT scan. Then we have got magnetic resonance imaging, positron emission tomography scan, Holter monitoring. Okay, that also can be done. Blood investigations are very important here. We know we commonly go for cardiac enzymes, isn't it? As soon as a person is having heart attack, we will first do cardiac enzyme. Then every 6th hourly or 12th hourly, we will do the blood investigations to see whether this cardiac enzymes like troponin, CKMB or myoglobin are increased. This topic is also covered in detail already. Please go through it. Other than that, CBC can be done. Maybe sometimes because of the inflammation, WBC count may be high and even C-reactive protein may be high. Next is you may also have to perform the fasting lipid profile to know the cholesterol levels or triglyceride levels. Okay, so normally it has to be less than 200 mg per dl. Okay, the cholesterol levels have to be less than 200 mg per dl. Other than that, to know if there is any damage to the kidney or liver, you can perform renal function test or liver function test, and also you can perform the fasting blood sugar, random blood sugar, and postprandial blood sugar. Next most important thing that we do is cardiac catheterization or coronary angiogram or angiography. What they do here, already I have told it. Catheter will be inserted into the femoral, radial or brachial artery, any of the artery. Once it reaches the heart, they will be injecting the dye in order to visualize the coronary arteries to see if there is any obstruction. Next is moving on to the medical management. Okay, so our main goal is to prevent complications and to preserve the function of the heart. So this is for your knowledge. Always remember, in the case of emergency, what you have to do for MI. Okay, so for that also one mnemonics is there, obese man. Okay, so the mnemonics is obese man. So what you have to do is, when a person comes to the hospital with MI, first you should give O oxygen, next beta blockers, atenolol, metoprolol, statins or lipid lowering agents like atorvastatin, enoxaparin, okay, or heparin. It is a type of heparin that is given in the hospitals. Morphine, that is to reduce the pain. A refers to aspirin or AC inhibitors. Okay, AC inhibitors are antihypertensives. Example, captopril, enalapril. N starts for nitrates. Okay, so obese man, you can remember this. This is done for emergency. One more is there, immediate treatment, Monatas. Okay, about Mona I have already told in angina, isn't it? So remember, M means morphine will be given, O means oxygen, N means nitroglycerin. Okay, A is aspirin, T means thrombolytics or fibrinolytics, A is anticoagulants, S is stool softeners. Why we are giving stool softeners? Because we already know that if there is vagal stimulation, what will happen? They strain at stool, chances are there that it will trigger heart attack. So we are giving stool softeners or laxatives. Okay, and sedatives also may be given, like your diazepam. Okay, so this is only regarding the immediate treatment. So just remember Monatas and the main heading of that. Okay, next one is, we'll see the medical management in detail. First of all, oxygen therapy. Now please note down, oxygen therapy and bed rest is not medical management, but since it is a immediate management, I have put in the slide. Okay, so oxygen therapy is given. Why? Because it will improve the oxygen supply to the heart. So always remember, when the person with MI is admitted, you have to provide oxygen. Okay, commonly we give through the nasal prongs. Okay, around 3 to 4 liters we give, and strictly bed rest is given. Okay, don't allow the person to walk around or run and all. Okay, or not to panic also. Okay, so let them be on bed rest. Okay, so that will reduce the workload on the heart. So this you are already knowing, the nasal prongs, the mask is there, isn't it? So these are the different ways of giving the oxygenation. Okay, here also we have got nasal prongs, mask is there. Okay, then we have got venturi mask, which is having lot of pores. Then non-breather mask is also there, nasal cannula. Okay, so in any method you can give the oxygenation to patient. Next is, in order to reduce the pain, chest pain is very severe, so only morphine or pethidine will be useful. If you give paracetamol mole and all, it is not at all effective. Okay, next is vasodilators. Commonly the vasodilator we give is nitroglycerin. It is available in the form of patches, sprays or even creams and all, and sublingual tablets. So that can be given to the patient. Okay, so that will dilate or relax the smooth muscles, and also it will reduce the coronary artery spasm. Next is, some antihypertensives are recommended. Now antihypertensives are given if a person is having hypertension. Commonly AC inhibitors like captopril, enalapril. It will reduce the workload on heart. Next one is beta blockers. Example, metoprolol, propranolol. This also will improve the oxygen supply to the heart. Next one is calcium channel blockers like amlodipine, nifedipine. Okay, it will decrease the workload on the heart. Please go through these drugs names and examples, because from a lot of time I am repeating the same drugs. Okay. Next is anticoagulants and antiplatelets also can be given, because it will inhibit the platelet aggregation and will prevent the clot formation. Okay, so dislodgement of the clots will be prevented. For that you can give heparin, aspirin or clopidogrel. Okay, so here you can see the drugs. So this is actually the commonest drug we give, aspirin and clopidogrel combined tablet. Okay, so this is heparin. Next drug is thrombolytics or fibrinolytics. Okay, so if already the clot is already there, what you have to do, you have to dissolve the clot, or lysis of the clot should be done. For that we are giving streptokinase or urokinase. Sometimes patient may experience arrhythmias, already I told, isn't it, in MI. So to prevent arrhythmias, we will give antiarrhythmic drugs like amiodarone, lidocaine, adenosine, procainamide, quinidine. Okay, so these drugs are antiarrhythmic. Next is cholesterol lowering drugs are also given, because I told patients cholesterol may be very high. So you can start taking tablets like atorvastatin. Please note down ATO. R is there, okay? R is missing here. Atorvastatin, lovastatin. Next is stool softeners or laxatives are given. Why? Because you want to prevent straining at stool and vagal stimulation that can trigger MI. Okay, so give some laxatives like cremafin or duflac to the patient. Next is surgical management. This already I have discussed, isn't it? In CAD I have discussed and also it was discussed in angina. So please go through it carefully. Okay, that is percutaneous intervention, percutaneous transluminal coronary angioplasty. Okay, then we have got CABG, open heart surgery, mid cap, op cap. Then we have got laser ablation, TMLR, atherectomy, embolectomy and thrombectomy. Okay, so this is just a picture of op cap, isn't it? Off pump coronary artery bypass graft, isn't it? So you are using some mechanical stabilizers here. This already I have discussed prior, isn't it? So go through the class and please be thorough. Next is complications of MI. Now complications are arrhythmias, cardiogenic shock. Why cardiogenic shock occurs? Because of decreased cardiac output. Heart failure, congestive cardiac failure and congestive heart failure, all are the same. Why it happens is because the heart is not able to pump the blood and to meet the metabolic needs of the body. Okay, now normally heart failure can happen weeks later after MI. Next is recurrent MI is also very common. After one MI, again and again you might have heard second attack, third attack and all, isn't it? Next most important complication is pericarditis, that is inflammation of pericardium. Okay, so now your pericarditis occurs within 2 to 4 days of MI. It is called as early pericarditis. Okay, so pericarditis means inflammation of pericardium. Pericardial effusion means what? Fluid accumulates around the heart in the pericardial sac. That is called pericardial effusion or cardiac tamponade. Okay. So this is one more important complication that is called as Dressler syndrome. Very important. Okay. So Dressler syndrome means it is late pericarditis. Okay. Means after 6 weeks or after months after MI you are developing Dressler syndrome. Dressler syndrome means late pericarditis. The main reason for Dressler syndrome is idiopathic. We are not knowing the exact reason. It could be autoimmunity. And symptoms here is patient will have fever, chest pain and they will be having pericardial friction rub. Remembering what is it? It is a abnormal heart sound, that is like a rubbing of leather. Okay, such heart sound will be heard. Why this pericardial friction rub is heard? Mainly because of pericardial effusion or because of the tamponade. Treatment is we can give steroids to reduce the inflammation, aspirin can be given to reduce the pain and anticoagulants or antiplatelets can also be given. Okay. So this is regarding myocardial rupture. So that is also one complication. And aneurysm. Aneurysm is also one more complication of MI. Okay, so again one more mnemonics I have written and given. Okay, one more mnemonics for complications. Okay, that is ectrapid. Okay, remember ectrapid and you can remember any of the complications. Okay, please students, you can go through the mnemonics later. Next is nursing diagnosis. Impaired gas exchange related to decreased blood flow, acute pain related to decreased myocardial oxygenation, impaired physical mobility related to weakness, imbalanced nutrition related to anorexia, insomnia related to chest pain, anxiety related to disease condition, and knowledge deficit related to disease condition. Okay, go through the nursing management, you can add up your own points. Okay, tell the person regarding the importance of diagnostic procedures, about lifestyle modification. Okay, then particularly what you have to do is you have to tell the person to avoid which and all items, all the fat containing food and all, and tell them to also take lot of green leafy vegetables and fruits. Okay, and lot of spices like turmeric, ginger, garlic, onion. Okay, all these herbs can be taken. Exercises are very good. Okay, like swimming or aerobics. Okay, that can be performed. Yoga also can be done, and laughter therapy and other therapies like your behavioral therapies also can be done in order to reduce the stress. And most of the time better to avoid salt, quit smoking, avoid obesity, reduce the body weight, avoid stress. Okay, and also excessive alcoholism should not be done by the person. Okay, then some of the nursing diagnosis interventions I have given, remaining you have to write it down because it is very very important. Okay, so most of the time interventions include monitoring vital signs, monitoring cardiac monitor, C for arrhythmias, then monitoring the ABG, monitoring intake output and weight of the patient. Okay, and if the person is having excessive anxiety, we know what we have to do. What is that? Reassure the patient and ask the family members to support the patient, provide relaxation therapies, isn't it? Then other than that, tell the patient to verbalize their feelings. Okay, so these and all things can be explained in detail in nursing management.